Hello, I'm Casey Aiken, and this is 21 This Week. Coming up next, as vaccines become available, state and county seek to control the increased spread of coronavirus. Remote learning is proving to be a disaster. When will MCPS open our schools? What does racial equity and social justice in county zoning mean? Our panel of insiders will give you the story behind the story. We're joined by education activist Cynthia Rubenstein, Secretary of the Maryland Republican Central Committee, Mark Uncapher, former membership directory for the Maryland GOP, Phil Bell, and the former mayor of Rockville, Susan Hoffmann. Stay tuned for these stories and more on the next 21 This Week. For the past 2 weeks, as the second wave of COVID infections in the state and county continue to rise, county officials struggle with a response. As of Tuesday, 17.7% of county hospital beds were filled with patients with the coronavirus, compared to 38.9% at the peak of the pandemic in May of this year. And while 61% of intensive care beds are in use, the data does not break down how many of these are COVID patients. Mark, the county continues to indicate that further restrictions to limit the spread of the virus in the county and the region could be on the horizon, but does that seem necessary until we see numbers that reach the levels we saw in May?
Well, it also seems that County Executive Elridge has been out of step with some of his colleagues around the region who are obviously part of the same region, but don't see the need. And of course, having different rules in such close proximity really defeats the efforts of Montgomery County if it takes a, how shall I say, more extreme or more hardline stance on closures. Well,
that's very true because, I mean, if Prince George's County or Frederick County or Howard County, they're a simple 30-minute drive from Rockville, and not if they're not enforcing it, then
right.
It's got to be a regional response, I would think. But
right.
So, Susan, the lockdown restrictions imposed in the spring did not stop the spread of the coronavirus. They may have slowed it down, but they didn't stop it completely. So why do officials believe this disease can be controlled by further restrictions?
Well, of course, as you said in your intro, the numbers are down dramatically from the spring, and we're learning more and more as we go. This is a new virus, and so the way it's spread and so forth is a little different. It's as I like to quote Dr. Oberholzer, it's swapping air, and so keeping people away from each other does keep the transmission down, and wearing masks keeps the transmission down, and that's exactly what we need to do. We need to keep people apart. So the numbers are down dramatically from when it first hit us in the spring. As it turns out, as best they know, the transmission increases in the cold weather just because it's colder. And so keeping apart from each other, sadly, is the best way to deal with it at this time.
Don't you think we're smart enough to figure that out? I mean, we all know someone who has had the COVID, and they tell you the story that they were innocuously sitting at an open air table with somebody and they got it. Or they just happened to see a relative and they got it. Don't you think we're smart enough to figure this out? Why do we need government to tell us more?
Well, based on everything that we've seen statistically as of today and what's going on in other parts of the country, I would beg to differ in terms of, are we smart enough? I think some of us are. Some of us respect our own bodies and our health and our future.
Susan, come on.
Around for next Thanksgiving. No. Casey, the numbers of people who traveled over Thanksgiving, we have no idea yet what that spike's going to look like. And those people should not have done what they did
Why?
They endangered themselves and others. So in terms of smart enough, I'm not going to call American people.
Wait a minute. How do you know that you're making a huge assumption? Because if I have dinner with my 4 children, am I going to, in my house, just because I traveled a mile to get to my place, is that any different than going 30 miles to see them out of state?
It has nothing to do with the distance. It has to do with whether or not they are in your bubble. And if you don't respect that, then you're not respecting the science.
They got their own bubble. Phil, are we getting good data and data interpretation from elected officials?
No, absolutely not. First of all, I want to be very upfront. I am number one. I do not respect the science at all because the science has been wrong. Let's look at what the public officials told us. When we were talking about the idea of flattening the curve actually went like this, and then it went back to 0. So we took the mitigation measures, we followed them, we followed the science, and what did we get? We got something that looked absolutely nothing like the supposedly flattened curve that we were supposed to do. From there, you look at what these government officials are telling us. They give us incorrect data. They have no standards for how the PCR tests are supposed to be run. They have no standards for how cases or deaths are reported, none whatsoever. All they have is the repeated idea of, well, you can't be around people, you can't do this, you can't do that, and we will tell you what to do. One important thing to remember, all of these stories about someone caught the virus and they think they know where they did it, they have nothing to verify that. Government has nothing to verify that. So therefore, the most important thing, let's live our lives.
Thank you, Phil. Now, Cynthia, fortunately, we may be able to live our lives a little better now that we're getting some indication that there will be vaccines available for the general public. And both the CDC and the state are trying to determine who should be the recipient of the vaccines. What do you think the government should do?
Well, I think there's agreement that the first cohort should be healthcare workers, anyone who comes in contact in a hospital or a medical in a medical setting. And then fast on the heels of that cohort should be residents in long-term care facilities, so nursing homes and assisted living and rehab centers. After that, it's essential workers, and that includes teachers and grocery workers and transit workers and anyone who faces the public and cannot work from home digitally. But the problem is deciding who's getting those scarce resources for vaccines, because they're going to be relatively trickling out. So there are going to be some hard decisions made, even in addressing which of the healthcare workers will receive them first.
I heard the mafia is going to have a black market on the vaccine. It's going to be running tests in an alley. So I got to exit question.
The test may not work. The vaccine may not work, but they'll be in the alley.
Well, so the question is, which one of you is willing to take the vaccine, and how soon are you willing to take it? Let's start with you, Mark.
I'll take it, and I wonder, are 21 this week pundits essential workers?
Yeah, no, we're decidedly
probably not.
We're decidedly unessential. Susan.
Yes, I would take it. Absolutely. I'll be standing right in line behind Dr. Fauci.
Me.
Bill.
Since I believe I have T-cell immunity, I'd like to verify that before I make a decision.
And Casey wants to take it. Since I'm not quite in this 70 years old and in the demographic that is most at danger, I'm willing to take it right away. So I guess I'll just have to stand right behind Susan Hoffmann for that.
Yeah.
All right, when we got to go on to our next topic. There seems to be more and more proof. Oh, I'm sorry, Cynthia.
You missed me, but I didn't want to speak over you. I'm absolutely, and if I could be vaccinated on TV, if I could be vaccinated on 21 this week, I would.
Carolyn, do you think we can arrange that? Yeah, absolutely. Carolyn's saying yes, absolutely. You know, you got to get the shot in your butt, though.
No, you're just saying that. You're just being provocative again.
Oh, darn. Silly me. All right, let's talk about what's going on in the schools, because that's of key importance. There's more and more proof that our school-age children are being negatively impacted by not being in school, whether it is from learning situations or from socialization. Cynthia, CNN reported that the pandemic is affecting all children negatively. So why can't we figure out how to safely get all our children back into the classroom?
Well, in one sentence, it's really complicated. As we are recording today, the Board of Education is meeting to pass the phased plan that would allow students to start returning to buildings. But that is contingent on meeting health metrics. And since we're entering the holiday season and anticipating loads of infections and hospitalizations, I'm not sure MCPS is going to be in buildings anytime soon. But there are a lot of complicating factors. Number one, are buildings prepared? What about transportation? What about PPE that will be required for students and teachers? What about contingency plans when there are infections? MCPS is making plans, but it's all contingent on what the virus does over the next few months.
Well,
And
it's not like they haven't had
it
any
happened.
to work on this.
They have been working on it, and parents are taking a survey. The survey closes on December 3rd. Parents are indicating across MCPS what they want for their children coming up, whether they want it hybrid or they want to continue online, whether they want to be back in the buildings.
Mark, in Florida, Governor DeSantis has kept all of the public schools open, but gave parents the option of having their children attend virtually or some kind of other model. Is that the appropriate model for MCPS to follow?
And I think that's a very balanced approach that MCPS follows. I'd point out that they did a survey, I think it was in July. Obviously, things have changed since then. And what that MCPS survey found was there was a range of opinions and attitudes as to whether or not to let kids go back in. I think there's clearly, there was an opportunity that was missed that would have allowed for prioritization for elementary kids or kids with special learning plans to have allowed them to go back. That was frankly the road that was not taken with MCPS.
So Phil, in California, 7 families are suing the state of California saying remote learning is harming Black and Latino children. Just recently, there was an article that said that 2nd graders and 3rd graders are reading below level and they may never catch up. And this is a prime indicator of how children will be successful in life later on. So are we doing the right thing by our children?
No, we're absolutely not. The most important thing that children learn in school is how to socialize with others, because that keys so much of how we live our lives. Taking that away from them, regardless of what their race is, regardless of what those studies are saying, is absolutely unconscionable. And you have these adults who had the opportunity to gain that, to sit there and say, we're going to arbitrarily take it away from you, is wrong.
So Susan, we haven't seen the numbers from Montgomery County, but we have seen numbers from neighboring Virginia, where it certainly seems that students are failing at a higher rate as a result of the remote learning not being successful. What's your solution would you have? Do you think that all of these kids should just repeat the year?
I actually have thought about that, and that if we did something nationally, it would put everybody at par, and no one would lose a year. I don't know if that's the right solution. I think the issue here is that there has been no national plan, no national guidance. We have had nothing from this administration, and that's why we are all at 6s and 7s as to what we should be doing and what our policy should be.
Susan, isn't school policy and education directed mainly from the state and local level and
Absolutely.
not the national level?
Absolutely, but what I'm talking about is guidance and best recommendations from experts, and we have had nothing from this administration, and we see now how it has impacted us in the most negative ways in all situations, not only in our education. But
Susan, the experts are all over the place on returning to schools, and you can cherry pick and pick evidence from different sources. And that's precisely why in our federal system, it makes sense let the governor of Florida use an approach for Florida and let New York do it its way and figure out what the best alternative is. The idea that sort of one size fits all is just an antiquated notion that really has no place in our kind of society.
Well, I'm going to have to let Mark have the last word here because we have to go to a hard break. And when we come back from this short break, what does racial equity and social justice in county zoning mean? Stay tuned. Welcome back. This week, the Montgomery County Council unanimously enacted legislation which will require racial equity and social justice impact statements for all new zoning text amendments. First, Susan, what is a racial equity and social justice impact statement, and why would it apply to a zoning amendment?
Well, just as we require fiscal impact statements with legislation as to how much it's going to cost the county and the county taxpayers when legislation is passed, we are now required to look at the racial equity impact. As you may know, back in the 1950s, zoning inequitable and favored the white and the privileged, and the Black and brown communities were not taken into consideration. They were not at the table, and much of zoning was restricted. It restricted people of color. It restricted certain religions. And so now we're looking at a way to be fair and more balanced.
Susan, in the 60s, we passed fair housing laws.
We're looking at ways to mitigate.
We've addressed all of those.
We have not.
What I want to ask you is, you were
Casey,
you were a mayor of Rockville.
Casey,
when someone came in with a zoning text amendment, it was usually to find out whether or not they needed enough parking spaces for their building.
Casey,
how does that need equity?
Zoning has negatively impacted across the nation, not just in Montgomery County, has negatively impacted people, the more marginalized communities. Everybody knows that. So don't raise your eyebrows and roll your eyes at me. You know that's true. And it.
Wait a second.
No, I don't.
People know that it's true.
No.
And very often force people. Are you going to talk over me or are you going to let me answer? Okay.
I gotta ask you, I'm Black. How am I'm supposedly, a marginal community, whatever that means. How am I negatively impacted by zoning? Now, I don't believe in zoning at all, but hey, look, you got to have 8 parking spaces for your building. End of story. Has nothing to do with skin color. Doesn't hurt anybody.
Let me give an example of what Minneapolis did to address inequities in housing. In certain single-family residential areas, they allowed duplexes to be built in replacing single-family homes so that people of lower income could live in single-family neighborhoods. That was a way to provide more equity among social classes and income classes. That's an example. That is one example that we could see in Montgomery County.
That's a terrible example. If you want to live in that area, get the money and go buy a house there. It's simple. That's
part-time
doing it. You can't live in that area.
That is an absolutely un-American statement.
No, it's very American.
That does not level the playing field. That is not opportunity for all.
Look at the Black people who move out of the hood. They move out of there for a reason. They want to go someplace that's not where they were. So
I would like to point out to you
to come to a single family area and say, okay, now I want to have the same thing I left behind over here.
It might be a young married couple with one child just starting out who cannot.
Go where you can afford.
Excuse me, I just want
to be in that neighborhood with its schools and amenities.
Casey, I would like to make another point, please. I want to just wrap this up. First of all,
briefly, please.
Respect, Mr. Bell. Just because you are African American does not make you the.
I'm not African American. Let me be clear. I'm Black. I've never been to Africa. I'm an American who happens to be Black.
I would commend to the audience and my colleagues on this panel, there are two things that you might want to take a look at. There's a brilliant book called The Color of Law, which covers the history of zoning in the United States and how it created, how zoning created systemic racism nationally. And on YouTube, you can see a film called Divided Highways, which deals with the development of transportation infrastructure. It's
Susan,
of
I
systemic
recommend that book, and I've read it too, and it makes a lot of good points. But as Casey said, there's a difference between what was described when there was, redlining and what have you, de jure policies, and what was addressed in the 1960s, and the deeply ideological approach of results orientation that is being applied. People who aspire to go to the suburbs transcend race, color, class. And if they don't want to live in a lower density community, they ought to be able to do that without your kind of making a decision for them based on zoning policy.
Well, we got to wrap this up. But the reason I am suspect of this legislation is that it takes the power out of the citizens and into the hands of the bureaucrats. Because in a zoning text amendment, you have citizens' involvement in this. If once you submit a decision-making body by appointed committees, then you're taking the decision of the people out of their hands. This is a terrible idea. Unfortunately, we can't get on to the rest of the segment. We have to wrap it up, and stay tuned for parting shots when we come back from this short break. Welcome back. Now with parting shots, Susan Hoffmann.
Yes, December 14th is a red letter day, a blue letter day, actually. It's my daughter's birthday, and it's the vote of the Electoral College Yay team.
Thank you, Susan. Phil Bell, your parting shot.
My parting shot today goes out to Dr. Walter E. Williams, who we lost earlier this week.
Yep.
I have been a conservative my entire life, but it wasn't until I think it was early 2010, driving around Miami, Florida, and Walter Williams was subbing for Rush Limbaugh. And I heard just one of the greatest messages that I had, from the radio in a long time. And Dr. Williams was great because not only was he a great economist and very well written, but he did not accept the premises of the left. And so if you're a conservative, young or old, that's the guy who you should look for to learn more from.
Cynthia Rubenstein, your parting shot.
Okay, I'm going to add to Susan's parting shot about dates. And another important date in December is December 17th, when the MCPS superintendent will release his projected FY22 budget. Then on January 20th, the governor will release his budget. And on January 21st, Susan and I will both be celebrating because we will have a new administration, and it is Joe Biden, Kamala Harris, and company.
Thank you, Cynthia. Mark Uncapher, your parting shot.
We've lost an extraordinary number of businesses in Montgomery County, and I think sometimes we get a little shell shock from it. But one in particular noteworthy is that Mrs. K's Toll House, a business that had been around for 90 years, began during the Great Depression, has succumbed. I guess there's a rental or lease sign up on it. It will be missed. It really is just one of the many indicators of the devastation that has resulted from COVID.
Thank you, Mark. It's a good reminder to us all. I think as we look around the landscape here in Montgomery County, we see a lot of closed businesses, dark windows, and we don't realize the full impact that COVID-19 will have on everyone. This will be a year to forget in so many ways. I want to apologize to Cynthia because Cynthia, on the Zoom call, when I have the script up, I can't see all of the people that are on the call, and so I apologize for skipping over you when you had a chance to take the flu shot quiz. And I want to thank the audience for tuning in each and every week to Montgomery County's hardest hitting political talk show. For 21 this week, I'm Casey Aiken.